Hello, everybody. I'm here with Dr. Doug Herron. He's a graduate of Palmer College of Chiropractic, so we have that in common. And
Yeah.
originally a US citizen, born and raised in the US, we have a familiar thread back to the Quad Cities where the birthplace of chiropractic was. And Doug graduated in
1983.
83 and was already here when I got to Australia to practice in 1997. He's always been connected with the profession, influential, interested in nearly every facet of chiropractic profession in Australia, including politically, educationally, and just the beautiful practice that he's engaged in, technique as well. So Doug, tell me how you got to Australia, and you were raised in Bettendorf, Iowa.
Yeah. My father worked for Bell Telephone, and we lived on the Iowa side of the river in Bettendorf I was in year 3 when we moved there and moved away in year 11. So I actually graduated high school in Joliet, Illinois, home of the Blues Brothers. But I made my way back after undergraduate education to the Quad Cities. So for me, it was like coming home to go to Palmer in 1980. And in that first year, my sister came up to live with us. And that's important because she met an Australian student who was going to graduate at the end of that year. And of course, she came back to Australia, married him, and came back to Australia. And his family offered me work 3 years later when I graduated. So that's how I ended up in Australia, in Perth, on a 3-year adventure tour to get professionally grounded, with a great opportunity, with no intention of staying in Australia or emigrating. It was strictly a work gig, connecting with family and all of that. And we got here and fell in love with it and stayed.
And what do you remember about the profession when you got here, Doug? What was it like? Any different?
The simplicity is what appealed to me, because I just wanted to be a clinician. I wanted to get patients, take their history, do the exam, find where I thought the subluxations were, deliver chiropractic adjustments, and see change. That's what I wanted to get good at. I didn't want to do paperwork. I didn't want to write reports. I didn't want to interact with insurance companies. And in Australia, it was just a matter of handing the receipt with the right code on it. And that was the report. It was just, you got paid for a spinal adjustment. And so I found chiropractic to practice very simple here, and that suited me down to the ground. And I hit the ground running with a clinic in the country area about two hours out of Perth, and cut my teeth in a well-established clinic that was originally established by some Gonstead chiropractors, Noel Patterson, Ray Murphy, and Phil Williams in Perth. And I came into that practice. I was the third chiropractor after they had left it. And so I jumped into that and worked in 2 small towns. One I lived in, the other one we commuted to twice a week, and had a fantastic practice growth, learning opportunity. And the people were very gracious to have a wet behind the ears chiropractor, but they had a wet behind the ears chiropractor who lived in their town. And I was the first chiropractor who actually lived where the clinics were.
Wow.
So I gave you a leg up, and I was a novelty because I was the only Yankee accent for a couple 100 kilometers. So, I kind of stood out like a sore thumb chiropractically and then culturally. And then we had a child there, came to Perth. My parents moved over for a season, and I worked for another chiropractor in Perth. And then in 1989, opened up my own practice and stayed there till I retired.
I call that the heyday of chiropractic. Looking back, how are you? Should we jump into the future? You've retired, but that's part of the reason I've done this podcast, because I want to hear from people. There's such a collective, what do you call it? Intelligence. There's a collective wisdom that we must keep alive. And what are your current thoughts on the profession? And then we'll jump into the future.
Yeah, I
try not to be too negative.
I have a little bit of frustration with it, because I still think the best thing that we have going for us is our unique idea. Now, the application of that idea uses, to me, that's our most powerful tool. So I'm not concerned with whether you know how to dry needle or whether you have massage in your clinic or whether you have any other therapies. I want to know, can you find and adjust subluxations and help the human being right in front of us benefit from a more connected nervous system and their physiology? And when I look at things on Facebook and different postings and stuff, I see a departure from the chiropractic idea. I see a departure from the power of the adjustment into, let's see what therapy and diagnosis is available. And I just think we're giving away the baby with the bathwater, because I was of that era when all else fails, adjust.
The devil's advocate would jump in here and say, but Doug, I'm a new graduate. I don't really know what a subluxation is. What is it?
Yeah. Well,
so tell me.
When I think of me learning about, I was a technique-oriented student, and a lot of us were back then. There was an SOT club at Palmer. There was an activator club at Palmer. There was a Gonstead club. All the mainline techniques had a club developing expertise and developing skills. You had it with upper cervical stuff when you went to Palmer. Crostic had a club there, and the HIO club. They're all there. And I feel like we've departed from that, but that was actually a strength, even though not all techniques seem congruent, there is a congruence to them. That just they approach things differently.
Okay, how would you answer that question, Doug? If I was a new graduate, what is a subluxation to you, Doug Herron?
Yeah, well, subluxation to me is just that entity that we're looking for primarily in the spine of joint dysfunction that has a neurological consequence, both segmentally and globally. So we have an interference in proprioception. We have an interference in mechanoreceptive. We have changes in the neuromuscular connection, and that has an effect into the autonomic nerve system that's going to affect the health and well-being of people, which is why we see some interesting results when we find and adjust subluxations for conditions that have never been researched, but they show up in our patients and we end up benefiting them.
So why do you think, like what you just said to me makes a lot of sense, and even to the layperson, it might make some sense too, but why do you think it's become such a difficult thing? Is it antagonism? Is it ignorance? Or is it something else?
My sense is from talking to students, because I still interact with some students that come through the clinic where I do some informal mentoring. They're actively discouraged from looking at the subluxation as a cornerstone of chiropractic. They're looking at it from a more of a biomedical model of chiropractic rather than a chiropractic model of chiropractic. And they're actively discouraged from even using the word subluxation. And so they're not thinking like chiropractors. I still remember some lectures that I heard back when I was a student in an early new grad, was think like a chiropractor. Reggie Gold said, think, damn it, think. And Virgil Strang, who you also interacted with, wanted to be chirocentric in his thinking. And I think our chirocentrism has been lost in almost like we've gone for a politically correct medico-legal kind of ersatz chiropractic that isn't really strong in chiropractic anymore.
So it sounds like from what you're saying that either the chiropractic profession that harks from the generation we do, like the Palmer lineage, we're either completely deluded or we are a paradigm. You're saying we're not in this medico framework. And, the question arises, is it actually a different paradigm? Is it a different way of seeing? Now, if it is that, which I suspect, will the time come? Because a lot of things are turning around now. I think a lot of medical doctors are fed up.
Yeah.
They can't move left or right.
I feel like there's been opportunity for chiropractic that we haven't taken because our academic side of our profession has gone to what I refer to as a pseudo-medical model, and that doesn't suit chiropractic. That doesn't mean we don't have legal obligations to look after our patients, but I want to look at them through a chiropractic mindset. I mean, the first question that I asked my associates when I was in practice was, I want to know where you think the subluxations are based on your history and exam and x-ray. I want to know where you think the subluxation. Now, are there some red or yellow flags that need to be attended to too, as far as maybe some outside referrals and whatnot? Yes, but I want to know the first, because you're a chiropractor first.
Yes.
And you're going to help them with chiropractic. So decide where you think the subluxations are appearing. And then if there's some other things that you need to do medico-legally, well, then do them. But most of the time, they've already done medical, legal, you know, the medical approach has been done.
Yeah, we're at the end of the road
for them, and that's why they're in your office. So the best thing you can do is offer them a chiropractic approach for their problem, not just another watered down, bastardized pseudo medical procedure.
Yes, which is kind of like not realizing what turf you're on. You know, the medical people do what they do quite well, and yet if we stuck to the spinal centric work that we do, call it subluxation or not, but the correction of the spinal dysfunction, whatever you want to call it, it's an untapped area. But anyway, any other thoughts on, say, your current standing or where you see it going in the future?
Yeah, I'm probably enough out of the loop that I don't have a good feel for it. I sense something positive by the new school that's come up in Adelaide that is aligning more with the New Zealand school in their idea of the chiropractic is a legitimate idea and entity, and we need to teach them chiropractic and chiropractic ideas. The philosophy is not just the historical concept, it's the cornerstone of our practice. Our idea that health comes from inside out, that spine and nerve system, it's brain to body and body to brain, and we need to restore that connection. If that's our approach, and then add in the other parts of it if we need to, you know, for professional safety or whatever, add those things in, but make chiropractic about the chiropractic approach and the uniqueness, the specialness, and the great benefits you get just by doing chiropractic. Yes. The other thing, Joe, is often I'll talk to the young practitioners that I'm working with in informal mentoring, and I'll talk to them that there is a chiropractic approach, but there's also some ands you can do. And there's nothing wrong with the ands, but let's make sure we're not confusing the patient that the and thing that we do becomes the main thing that we do. We need to do chiropractic first and add the others on as needed.
Yeah, Philip Eberl touched on this, in that I said to him, if you had $1 trillion, what would you do? And he elected that he would start an institution and make it based on modern and traditional principles. So it seems like at some point we sold our souls to the university system, which was beneficial. Then, if anyone who's awake and breathing right now can see that most universities now are something else, and I don't know enough about the political framework to say it, but they're not breeding grounds of innovation. They're just like, what are they? They're just like—
No, they're not teaching you how to think anymore, Joe. Right. They're teaching you what to think.
Philosophy. And the ground, and philosophy in chiropractic's been our cornerstone. You know, some people abuse it because they haven't got the slightest idea what philosophy is. But I think what you're saying is education, education, education.
Well, I can remember in the 90s when dynamic growth congresses were raising money through an intra-professional seminar. We gave a seminar to ourselves. Nobody got paid. We raised money for spinal research. And the academics at the institutions, and this is in the late 80s, early 90s, discouraged students from attending because philosophy was being discussed. And that was so disappointing to think, hold on, we've got this idea that our profession's based on. That idea results in a service to people, a particular approach to health that's different than the mainstream approach. And then our students aren't being trained in it, apparently, because they're being actively discouraged from going to an event that talked about it.
Yeah.
And I think to some degree that still continues, because I know that one of the chiropractors I interact with here in Perth has had a second-year student come into his clinic, and the student said to him last week that he learned more about chiropractic in 2 or 3 observing sessions than he learned in 18 months of training at the local institution, because he was demonstrated and discussed chiropractic approach and why this chiropractor did what he did as he interacted with his patients.
I think that it all comes back to this argument about centralized control again, and where the people were being censored from going to the dynamic growth seminar because they might be exposed to some taboo thing. Look at it now with Facebook and Twitter and banning and, you know, it seems to be the way that's why the conspiracy theorists are currently in the lead, because they've been saying that there's an unseen control factor here. And that is stop you thinking, lest you move out of the central groove, which then interferes with empowering the patient. And wasn't that a big thing about our education at Palmer, is that it was not only chirocentric, but patient-centered. That's
absolutely. That was one of the catchphrases when I was going through was patient-centered care. And that was about giving them information, letting them make decisions about not only having seeing a chiropractor getting adjusted, but making decisions on diet, making decisions on exercise, making decisions on posture and habits. And those things are still part of a well-rounded practice today. If you're finding and adjusting subluxations and you're not addressing lifestyle issues that are contributing to it, I still think we're selling patients short. Because I was never one who believed that chiropractic was a cure-all. In fact, that's one of the first things I used to say in a patient workshop or a health workshop. Chiropractic's not a cure-all, but it's an important cog that every other profession ignores. Every other professions talk about diet, other professions talk about exercise, other professions talk about ergonomics and posture. Chiropractic's the only one that talks about the brain-body connection. And that let's make sure we emphasize that and add in those other wellness topics, because people need those as well, and they need to be coached and supported and encouraged with those other things. So I do 55 minutes on chiropractic and 5 minutes on the other things if I was doing an hour, because I wanted them to get chiropractic from a chiropractor's mouth. Now we have things on Facebook where we're worried about what kind of chiropractor we're going to send them to in other localities, because we don't know whether they're going to be presented chiropractic the way we might present chiropractic. So do you do dry needling? Do you do a diagnosis? Do you do, some aspect of this new wave of chiropractic? And if you don't, well, you don't go to a cultist or an old timer that actually talks about subluxation and the body healing itself and those kind of things. Do you see that being differentiated on Facebook and other platforms?
Yeah. What are your thoughts on the future then? Do you think that we could take this as an opportunity, or we've got to hit our heads against the wall a few more times before we wake up?
Yeah. I was told in 1976 by an orthopedic surgeon, I was trying to earn money to buy my wife an engagement ring. And so I took a job in the evenings mowing the yard of a local orthopedic surgeon. And he told me, and this is exactly what he told me, and I still remember this, that medicine investigated the chiropractic idea, found that it had no merit. And why would you want to go do that anyway? You're smart enough, you could go become a proper doctor. Well, number one, he lied to me. Medicine never investigated chiropractic to see if it had merit or not. They never did that.
Did you believe
just rubbished it because it wasn't
them?
them.
Back then? Did you believe?
Oh, no, heavens no. I knew he was full of crap.
Okay.
And I wasn't even in chiropractic education. I was just doing my science degree at that point. And I knew he was full of it.
Yes.
And because it had helped me and my family so much that there's no way, I knew that medical antagonism existed. And I don't know, Joe, the sense of, trying to get them to approve us and like us, that's never happened. It's never going to work. We've just got to stand on what our strength is. And I think there's always going to be a remnant that's going to do that. Whether that becomes the dominant remnant in the profession, I don't know. Because that doesn't appear, but it seems like as one school of thought kind of grows, another school of thought is, adds in. Yeah. So, we end up with another chiropractic school in Australia that's going to be more congruent with the traditional practice of chiropractic versus the 3 or 4 schools that are already here. And yet 30 years ago, Joe, when I arrived in Australia, there was, 2 accredited schools, 1 accredited and 1, nearly accredited.
Yeah.
And, it was a very different environment back then.
Yeah.
Now we've got 5 schools in Australia,
mm-hmm.
And there's a couple more in Asia now as well. So it's, it's that changing environment. And I wish it was an environment that was, as Strang would have said, chirocentric, emphasizing the best parts of our idea and the best parts of the practice of that idea. And I'm not convinced that that's actually going to happen, but I don't think it's going to go away. Those ideas aren't going to disappear. They're just not going to be as widely accepted as I wish they were.
It seems like that from what you say, I'm reminded of the element of fear as a big factor, because the only way they've really, like this guy, the orthopedic said to you, well, we investigated it and we found it was untrue. They either use that method or they use one of fear that the chiropractor will kill you. I remember in the old days, we couldn't say to a patient, you may not need to take that antibiotic, and we could be sued for discontinuing medicine. Now, then, 2 years ago, I hear a leading experts in infectious disease say, when the infection looks like it's cleared up or you have side effects, stop it. There is no evidence that even completing the course of the antibiotic is necessary. So the whole premise was based on a lie, based on fear, that if you didn't take an antibiotic, you might die of an infection. And now we see it now with this, there may be quite legitimately a virus out there, but how much does fear play a role in it? And with chiropractic, a lot of it's fear. But from what you've said, if you stick to, what is the truth, but stick to your principles, it all comes full circle anyway. So maybe, we're at the beginning.
Yeah, I just felt, I practiced for 35 years. Heavens. And I felt like I had a clear idea of what I was there to do as a chiropractor. I had a way to apply it and communicate it to a patient. And I know that I help thousands of people.
Yes.
Just by doing chiropractic. And the cases that stand out in my mind are the ones that had given up, but made, kind of chiropractic was their last chance, because they'd been told that it was impossible to get better, or they'd been told that nobody, if I, the medical doctor can't help you, then nobody can help you. And yet we were able to help them by applying a different idea, not by doing medicine better, but by doing something that was different. And by being congruent with that, I never felt, out of depth in my whole practice life, because I had an idea and I knew how to apply it, and I stuck to that. And so I could sleep good at night because I wasn't pissing in anybody's boot. I was telling them what I believed. I was telling them what I thought, how I believed it could benefit them. Do you want it or not? If you don't want it, that's okay.
Mm-hmm.
But if you want it, I'll give it to you here, and I'll give it to you good, and you're gonna gain some benefit from it.
Yes.
And I don't mean that in a smarmy way. That's how I approached it.
No, what that says is that you recognize that person's innate ability to make a choice without fear. So
if I could give you the information and give you a way to say yes or no, I'm going to sleep good at night, even if you say no.
Yes.
I can, as long as I've told you the truth and giving you a chance to choose it. And if you're not in a position where you're ready to choose that yet, and I'm sure you've had this, Joe, where somebody actually says no in the beginning.
Yeah.
And then comes back to your clinic a year or 2 or 3 later and said, I've thought about it some more. I've tried a couple other things.
Yep.
And I want to give a go to that thing that we talked about a year or 2 or 3 or 4 ago. And they're great patients once they've had a chance to process.
Yeah. So in closing, Doug, you've got a few students or 1,000 students in front of you. What's your closing sort of comment, few minutes that you'd like to tell them?
I would encourage them to find some mentoring with a chiropractor that has some of the old-fashioned principles and practices that way, and learn about that part of chiropractic. Because even if they do the kind of pseudo-medical chiropractic that I see around me, they don't want to not have the chiropractic adjustment tool, the chiropractic subluxation correction tool in their bag. They need to understand that tool is powerful. It's more powerful than all the other tools they're being trained in. And if they have that powerful tool, even if they choose to use the other tools from time to time, there's a line from a movie, and I can't even remember which movie now. You don't bring a gun to you don't bring a knife to a gunfight. All these things you're learning are lovely, but if you want to bring a gun, bring the ability to find the subluxation, bring the ability to adjust the subluxation, be in a position to explain the chiropractic idea and principles to people, and give them a chance to choose it, with you providing the application. And you'll have a massively successful practice, because you're going to make a difference in more lives than just doing a variety of therapies over a few years.
Thanks, Doug. You're the voice of experience, whether you like it or not. It's been great chatting with you. I've always enjoyed our chats. We may even chat soon, and I appreciate you still being in the game.
Anytime, Joe. I still try to think a little bit. I'm not as sharp as I once was, but I'm not gone either.
We're still here, my friend.
Still here. Thanks, Joe.